Hello everyone, I am Dr. Mohammed Hamza, consultant pathologist working in NASA hospital. What is the role of pathology in cancer diagnosis? So pathology is a subject where we deal with the diagnosis and reporting of various body samples, body fluids and biopsies. So there are different sections under pathology which will help in the diagnosis of cancer in the patient. So we have divided pathology into histopathology, cytopathology, clinical pathology and hematology. As we all know, hematology deals with the blood and its elements. So the role of hematology, the blood samples which will be included for the diagnosis of cancer include. So first of all, we could detect if the patient is having any leukemias. So blood cancer, in general terms it is called as blood cancer, which is nothing but leukemia. So which can be detected very easily in a simple peripheral smear. So the different types of leukemia include AML, which is nothing but acute myeloid leukemia, then ALL, which is acute lymphoid leukemia, then CML, which is chronic myeloid leukemia, and CLL, which is chronic lymphoid leukemia. So these are the different leukemias which could be easily detected in a simple peripheral smear. So coming to the clinical pathology deals with the body fluids which can be used to analyze and detect and diagnose if any malignancy or malignant cells which could be present in the samples. So what are the different various body fluids which could be which we receive for analysis? So the first thing will be CSF, which is nothing but cerebrospinal fluid. Then we have the pleural fluid, then ascitic fluid, synovial fluid, semen analysis. So all these are different body fluids. So the fluids could be a marker where the tumor cells could be dislodged in the fluids and which will be helped in diagnosing the malignancy, which could be easily picked up by simple microscopic examination of these body fluids. Then we have histopathology. Histopathology deals with the examination of the tissues either as biopsies or as resected specimens. So histopathology will be the gold standard. It will be a confirmatory test for the diagnosis of any condition, especially malignancies. So what we do here is the sample, the biopsy is taken, then it will be fixed in formalin and it will be processed, and we will make 10 slices of the tissue and put it in the slide and stain it. Then we observe under the microscope to make a proper confirmed diagnosis of the malignancy. So histopathology is the ultimate gold standard for diagnosing malignancy. Then we have cytopathology. Cytopathology deals with the examination of the cells. So what we do here is the most common procedure investigation which comes under cytopathology is nothing but FNAC. So FNAC stands for fine needle aspiration cytology. So what happens here is the patient comes to the OPD as a simple routine procedure where if he's an elderly patient and he's having risk factors for malignancy with example in the form of tobacco chewing, and he's developed a cervical lymph node, lymphadenopathy, so enlargement of the lymph node. So he comes for FNAC. So what we do is we take a syringe and we insert the needle in the lesion or the lump. Here in this case it is a lymph node, lymphadenopathy. So we insert the needle, do needling, and then we aspirate the material from there, material in the form of cells. What we do is we spread the material on the slide and spread it, stain it and observe under the microscope. So with the help of microscope and FNAC technique, we can easily diagnose if the patient is having metastasis or if there is a primary malignancy anywhere for proper detection and confirmed diagnosis.